urine analysis and microscopy. The analysis of urine can be divided into 4 main categories. They are macroscopic, microscopic, chemical and bacteriological analysis. Before we get into each analysis, first, we will look at how we collect a sample of urine. Urine is collected to a sterile wide-mouth cup with a screw cap as shown in the picture. If a male is collecting urine, the foreskin must be retracted. And if a female is collecting urine, the labial folds must be separated. The first part of the urine must be disposed to reduce contamination from skin flora and the urethra. This ensures accurate readings in bacteriological studies. Once collected, immediately close the lid, label it accurately with the patient details, fill in the request forms and send to the lab immediately. If the sample is delayed for more than 1 hour, it should be kept in a refrigerator. We'll focus on the macroscopy and the microscopy in this video. Normally, 700 to 2,500 milliliters of urine per day is produced, which is 0.5 to 1 milliliter per kilogram per hour. It can be increased in conditions like high fluid intake, consumption of alcohol, taking diuretics, diabetes, and so on. It can be decreased in conditions like decreased fluid intake, dehydration, and so on. Anuria is the absence of a urine output. It is seen in conditions like acute renal failure and urinary tract obstruction. Oliguria is a urine output of less than 400 milliliters per day in an adult. It is seen in conditions like severe dehydration, acute renal failure, and acute glomerulonephritis. Polyuria is a urine output of more than 2,500 milliliters per day, and it's seen in diabetes mellitus, diabetes insipidus, and chronic renal failure. When we consider the color of urine, as shown in the picture, different urine colors occur due to different conditions. In a healthy individual, urine is usually a light straw color. This is due to the pigments urochrome and uroethrin. It darkens on standing due to oxidation of urobilinogen to urobilin. The following colors seen in urine is abnormal and warrants further investigations. Tea-colored urine is due to conjugated bilirubin in urine, in conditions causing obstructive jaundice. Dark red urine is due to hemoglobin in urine, in conditions causing intravascular hemolysis. Bright red urine is due to a large number of red blood cells in urine. Black color urine is seen in phenylketonuria. Ingesting certain drugs and foods can give rise to different urine colors as well. The appearance of urine can change due to several conditions as well. A smoky appearance suggests a little amount of red blood cells in urine. Turbid appearance suggests proteins in urine. Frothy urine can mean protein and bile salts in urine. Urine can have a fishy smell if ketone bodies are present in urine, in the condition known as diabetic ketoacidosis. A whitish precipitate can be seen in heavy proteinuria. There are several things that can appear in a urine sample and the microscope. They are cells, casts, and crystals. There are 3 main cell types we look for in urine microscopy. They are red blood cells, white blood cells, and epithelial cells. Red blood cells are typically not seen in males and seen only in small amounts in females. Increased amounts of red blood cells are seen in conditions like glomerulonephritis, urinary tract infections, and urinary calculi. White blood cells, also known as pus cells, are normally seen less than 10 cells per cubic millimeter of urine. Increased amounts are seen in urinary tract infections. Epithelial cells are normally only seen in little amounts in urine. Large amounts of epithelial cells suggest some tubular damage has occurred. Casts are cylindrical structures formed by precipitation of mucoproteins in the tubular lumen. There are 3 types of casts: hyaline casts, cellular casts, which are hyaline casts with cells embedded in them, and granular casts, which are cellular casts with disintegrated cells. Crystals are formed by the precipitation of chemicals in urine. You can pause the video and go through all the types of casts at your leisure. That brings us to the end of this video. Thank you for watching.